Misinformation about diabetes is as common as the diagnosis itself. If you or a loved one has diagnosed with diabetes, make sure you know these facts. Number 1. Too much sugar does not cause diabetes. Being overweight is a major risk factor, and foods that are high in added sugar are high in calories. Eating red meat is another potential culprit. If you are at risk, you should lower your total calorie intake and get those calories from nutrient-rich foods like whole grains, vegetables, and low-fat protein and dairy. When you want to eat a sweet, focus on foods with non-processed sugar. Number 2. If you have type 2 diabetes, you do not need insulin. Most people don't need insulin because they can control their diabetes through exercise and diet or oral medication. Your need for insulin may change with age. According to the Centers for Disease Control and Prevention, only 40% with type 2 diabetes need insulin. In case to keep your blood glucose levels in a healthy range, you might need to use insulin. Because your disease has progressed and now you are taking the best step to control it. Number 3. It can take months or years for symptoms to figure out type 2 diabetes. According to diabetes doctors, it can take time for symptoms to get enough for people to find out on their own that they have type 2 diabetes. That's because the most common signs, thirst and increased urination, are easy to overlook as part of getting older. More noticeable symptoms of diabetes are blurry vision, frequent urination, or tingling feet and hands prompt. The way to diagnose diabetes is a blood sample will give your doctor an image of your blood glucose levels over the past 3 months. Number 4. You can get any type of diabetes at any age. According to the doctors, you can get diabetes at any age. In type 1 diabetes, the body attacks the pancreatic beta cells by mistake, causing them to stop making insulin, the hormone that lowers glucose in the blood. And type 1 diabetes patients need to take insulin to normalize their blood sugar or they will become very ill. With type 2 diabetes, the pancreas makes insulin, but the body doesn't respond well to it. To tell the difference, your doctor may test for certain antibodies in your blood. Number 5. Exercise helps to control diabetes without needing insulin. Exercise may help people lose weight and also increases insulin sensitivity, which naturally lowers your blood glucose. Studies have shown that an exercise can improve insulin sensitivity by up to 50% for as long as 72 hours after sweating, even if you do not lose weight and it stays exactly the same. This is because when your muscle cells are active, they are able to take up glucose and use it for energy without a need of insulin.